Hi, everybody, and welcome to our session on deploying evidence to inform decisions and build accountability, reimagining health systems in the era of increased humanitarian crises. When we designed this session almost a year and a half ago, we did not know or expect that COVID-19 was going to happen. And little behold, the biggest pandemic that we've ever faced is currently occurring, which puts into position our session in the perfect timing. What we're looking at today and what we're hoping to share with all of you is some key sharing lessons on how to support evidence use in crises, sharing lessons from across sectors and across the countries and world shared by some incredible women who are about to join me today. When we initially planned this session, we were hoping to make it a simulation-based session. So we give you a sort of a very practical way of engaging with this content. Unfortunately, due to the virtual delivery, we actually tried to shift into more of a panel discussion, which I believe will still deliver on the main messages. I welcome all of you to share with us your discussions and your questions on the online platform. And please feel free to share with us any questions or concerns you might have post the session. In Arabic, بنرحب فيكم كلكم ونشكر لكم جهودكم وتشارككم معنا في هذا السيشن. I will leave the interpretation for the experts in this, and you can do so by clicking on the platform and clicking on the language choice that's available, and then switching to the audio of that language choice. If you have any questions at any point on the technological ability of the platform, please feel free to click on live support. My name is Firas Khalid. I'm a medical doctor and a health policy expert at McMaster University in Canada. I've devoted the past 5 years of my life looking better at how to support evidence use in crisis zones. And my job today is to help you understand a little bit better some of the strategies that myself and my colleagues have come up with or deployed in different sectors around the world on how to support evidence use in crisis zones. I want to share with you a bit of a tips on the platform and how you can use the platform to make sure that this is as engaging of a session as possible. As I said earlier, there is a support chat button, which is right on the top right-hand corner of your screen. You can access the support chat functions on the right-hand corner of the page at any time if you face any technical issues. The team is ready to help you at any moment. We welcome questions throughout the session. If there's something you would like further information on, or you would like to ask one of our panelists a question on the content we're presenting, please feel free to drop it into the live Q&A. We will take all questions at the end of the session. For the best user experience of the virtual session, please view the session in full screen. The sessions are being recorded, and so it's important that you understand that early on. So on to our great session today. We're going to present to you from 4 different systems that are different yet interconnected. We start our presentation with the political system, then move through the health system, international humanitarian aid, and we wrap it up by the health research system. My work that's led into a publication looked at the strategies to support evidence use from all 4 key systems, where we leverage the facilitators and address the barriers. So to give you some examples of what we mean by that, in the political system, we've seen that stakeholder dialogues are very effective strategies of deploying evidence to support evidence use in crisis zones. I want to take a moment and just make a very clear distinction here, is that we're not saying that research evidence is the only input into decision-making in crisis zones. We're saying that research evidence, data, tacit knowledge, other types of information are all tools of knowledge or types of information that decision makers can utilize during a crisis to help inform a decision. Today's session is focusing on sharing some of those key lessons stemming from those 4 interconnected systems. I'm happy to share this particular framework you're seeing in the slides with any of you. It is available at Health Systems and Policy Journal, where I actually go through each one of those strategies and how do you engage decision makers in evidence-informed decision making. I turn it over now to our first guest speaker. It's an honor and a joy to have her with us. She's a friend and a colleague, Ms. Fiona, who will speak on the evidence use in the political system, sharing some lessons she's acquired through her own practice. Fiona, over to you.
Thank you very much, Firas. I'm pleased to join you in this very important discussion during this very important conference. I'm Fiona Kaikai. I work with UNFPA, the United Nations Population Fund. Next, please. And as Firaz says, I'll be presenting about evidence used in the political system and basically focusing on key lessons learned that informed our decision-making during the program implementation. So a little bit about my organization. Next, please. UNFPA is the UN Sexual Reproductive Health Agency, and which aims to deliver a world where every pregnancy is wanted, every childbirth is safe, and every young person's potential is fulfilled. We work to ensure that everybody's rights and choices are fulfilled and they can access every services that they require. Next, please. So in my presentation, I'm going to talk about two key interventions that happened in two different countries, but also during similar crisis situations. And in crisis, in this case, I'm talking about health emergencies that have occurred. One, the Ebola that happened in Sierra Leone between 2014 and 2017, but also the COVID situation that we are currently facing now, currently facing the COVID pandemic. So in Sierra Leone faced the Ebola in 2014 to 2017, and major challenges, which similar to the COVID situation, were the reduced access to services, particularly for pregnant women, and also that schools were closed. People could not access most of the services. They could not. They were asked to stay home, stay away. No social distances was also one of the key methodologies to prevent spread. And so during that period, since the schools were closed, a lot of children, a lot of young girls became pregnant. UNFPA undertook a study to assess the number of girls who became pregnant during this period. Particularly, the focus of the assessment was to estimate how many girls between the ages of 11 and 19 who fell pregnant during the key period of May 2014 and November 2015. And from that, the assessment, the results received was that 18,119 girls became pregnant during that short period of May 2015 and November 2015. Sorry, May 2014 and November 2015. My mistake there. When the results were shared with the government was taken aback. They were shocked. And they were at a point where they were ready to resist the data that was being presented to them. And, but the evidence was speaking for itself. And so we had to use several engagements to ensure that this information was captured and understood, and also that we could use it to build on the programs that we needed to provide for the girls. And underlying all of that is that because the girls were pregnant, the government put its foot down to say that girls who were pregnant or had had children at that time were not going to be allowed back in school. And so that law or that policy that was established at that time drove further engagement with the government to ensure that we can't leave 18,000 girls behind. Next, please. So what did we do? We engaged the government. We further discussed and said, if the data is not satisfactory to you, let's see how we can redo another assessment or do another assessment to determine what we will be pleasing to you. So the government used its own system to generate additional data, and that further brought forward more and more and more information that the girls there were so many more girls who had become pregnant during that time. So we designed programs to ensure that the girls would have access to education. So there were special classes that were provided for pregnant girls during that period, and also the girls who had delivered during that period, and also provided special services, outreach services, so that girls could access sexual reproductive health and deliver safely, and also be able to access family planning for postnatal family planning. And also provided psychosocial support to ensure that they had rehabilitation for those who would say that the results, they had faced gender-based violence. Over and above, with the interventions that we did, over 11,000 girls were supported to go back into mainstream school, and over 6,000 girls were supported to deliver in facility. We could not have achieved this if we did not have sustained advocacy. And also through sustained sustained advocacy, the ban on the pregnant girls accessing education while pregnant has been lifted in 2019. So this is one situation where we had to sustain continuous advocacy to ensure that the system would respond to the needs of the population that was required. Next, please. In the second scenario, we're talking about the situation that has arisen due to the COVID-19 pandemic. And because of the COVID-19 pandemic, a lot of measures were put in place to prevent the spread of the infection. With that included the lockdown, countries locked down, which meant that services stopped, no delivery of commodities, limited transportation, fear of infections, lack of services. Our systems were not completely prepared to respond to this kind of a situation. And so most people had little or no access to services. Again, what did we have to do? We had to generate the information that needed to convince the policymakers and the politicians that services needed to be opened to facilitate access, particularly for our pregnant women and for family planning services, also for gender-based violence services, because during the same period, during the assessment, the information we generated was that 67% of women, of mothers, could not deliver in facilities due to transportation challenges. Also, a lot of people had to walk long distances to access the facilities. But over and above that, most people were afraid to access the services because they were worried about getting infected. On the other side, when it came to gender-based violence, the rates of rape increased in some districts by 50%. In some places, intimate partner violence increased by 50, 60, 70%. Over and above, we needed to have the evidence to convince our political leaders that certain services cannot be put on lockdown. Certain services needed to be accessible for the population, particularly the most vulnerable, the pregnant women, the girls who needed services for family planning and other things. Next slide, please. So with all of that, the data generated allowed us to design programs to respond to the needs of the women and girls. We provided ambulatory services so that women were supported to access the facilities. They were picked up from their homes and taken to the facilities and taken back to the communities. The community volunteers were also supported to map out who were the pregnant women within these communities so that the health workers knew how many women they needed to deal with within the period, how many were going to deliver, and what stages of pregnancy that they were, and what services needed to be provided. Again, because of the fear of health for their own health, midwives were also supported with protective gear so that they could protect themselves during the provision of services. And last but not least, and most importantly in this whole discussion, the political leaders, the community chairmen, the district chairpersons within the districts that we work with, which are mostly the refugee hosting districts, the districts where there have been landslides and other natural disasters. These political leaders, community chairpersons and district chairpersons were guided, were supported, were empowered to participate in the identification of their community members who were in need, to monitor the service provision, and to ensure that the community and the people within their communities benefited from the opportunities that were being provided, the ambulatory services, the midwives, and several other services that were related to gender-based violence prevention. Next slide, please. So in conclusion, I would say some of the key things when it comes to engaging our political leaders and making sure that they are informed for better decision-making, and to ensure that the question really is ensuring that our political leaders invest in the systems, in the needs of the population, is to ensure that we have the right documentation, the right evidence. We ensure that we have the necessary data, engage, and continuously engage, ensure that we continuously work with the government and work with the people so that they also own the data, as we saw from the situation in Sierra Leone. When they felt that they were not part of the process, they could easily have said, no, we don't want this information, it is wrong. But we worked with them to ensure that they understood the importance of the data, and ensured accountability of the resources that we delivered, that we utilized to deliver the services. And as I said, engage. Continuous advocacy can only be done when the evidence is available. So I would take the opportunity to thank, next slide please, to thank my colleagues in Sierra Leone and my colleagues in Uganda for all the support that they provided in ensuring that we deliver the right services that we have. Thank you. Next slide, please. And working through the ministries, both governments in Sierra Leone and governments in Uganda, I want to thank you for the opportunity to present this information. Over to you, Firas.
Thanks, Fiona. I think what you've demonstrated this presentation is like, I took away 3 key big words. I was trying to make word clouds as you were talking: engagement, ownership, and real-time research evidence. I think we often, people who work in this space of evidence-informed decision-making, we're always looking at things usually that don't have immediate effects. And what you brilliantly presented right now is a situation where we're actually seeing something that has an implications on real life in an immediate real-time situation. So thank you for sharing that. We greatly appreciate that. And we're again opening up the floor to any questions anybody have on Fiona's presentation or things you want us to dig a little bit more closer on it. We turn our attention now to the next slide, please, where we are joined by a fellow friend and a colleague, Ms. Sultana Sabahi from Oman. Sultana will focus on the evidence use in the health system. Over to you, Sultana.
Thank you very much, Firas, and thank you, Fiona, for a fantastic example about using evidence. So I am from the Sultanate of Oman, working at the Research Center and Ministry of Health, particularly heading the Department of Knowledge Translation. And as Firas from the beginning said, and Fiona also mentions, the policy-informed policymaking process is a complicated one. And it requires a lot of skill and capacities. So this is in a regular pace. So you can imagine how this readiness of the system should be in a crisis situation. Therefore, there was a tendency to institutionalize the evidence-informed policymaking approach and assigning this work to a particular group, whether a department, separate organization, or a forum. It has different names. And what I'm going to present here today, next please, is a conceptual framework which we have developed based on reviewing literatures, including 52 documents, including policy, what we call it here, policy support organizations. These are the organizations which supposed to provide evidence for the policy makers in a timely manner, in a systematic and transparent way. So we included such organizations from countries across the world, and sorry, we used the empirical and non-empirical literatures. Next. So in this framework, we actually have 4 main stages if anybody is planning to establish an organization to support policy makers. So if these organizations will exist, that means it will be easier to approach them, and it will be easier to utilize an evidence in a time of a crisis. So we basically came out with these 4 stages, which any organization or any countries wanted to establish such organization should expect to go through this. These are the awareness stage, development, assessments, and maturation stage. Starting with the first stage in detail, next, the awareness stage, we actually here, mainly the country should focus on building the capacity to support policymakers. So to make sure then when the policymakers buys the idea, we have the right capacity to support, well, like the capacity which will be able to find, appraise, and synthesize the evidence in a friendly way. And we also should identify the gaps in the systems if there is any fragmentations, and how that fragmentations affected the connections between policymakers and researchers, and how such organizations might help in bridging that gap. Next. So once this awareness is established, then the next logical stage is the development stage, where the actual development of the organization most likely will take place. And there are 2 main components in this stage. One is evaluating the situation, and there have been different approaches identified to do so. The first one is conducting a situation analysis, actually, to identify who is doing what, how, and why. So doing this will give you a clear picture about the capacities you have, the gaps you have, and who you can connect with, when, and who you might also target as a people with power to help you advocating for the importance of such organization. Other countries actually took a different approach, which is called a proof of concept, which means they will handle an urgent or an important issue, and they will run more than one activities. For example, conducting a policy brief, a policy dialogue, contacting the media, and providing viable solutions for the policymakers, and in a timely manner. So doing that will convince the policymakers about the importance of having such organizations in the system. Once the evaluation is completed, then the next, they should also start to define, and then the evaluation should inform the defining the organization attributes. So they should have a strong leadership who should have a sufficient skill and knowledge regarding research and the policy as well. They should clearly define the organization structure, where is the best location for the organization, whether it should be within the government Ministry of Health, whether it should be independent or in academic institutions. And all of these decisions depends on the context of the country, where the policymakers, which source or which location will be more trusted, will be able to be more transparent, and their findings and products will be utilized. They should also consider having a sustainable source of fund. Many organizations started with fund from international organizations, but then they faces some challenges to continue. That's why it's important to have a clear pictures about different source of fund and how to sustain them. They should have a capable human resources who can find, synthesize, and appraise and synthesize evidence in a timely manner, and who have a very good communication skill as well. And also, it's important in this stage to have the sufficient infrastructures. That's why many of them, like, they tended to build on the existing resources, like wherever they will be, whether in an academic or government or independent. It's important to have a sufficient infrastructure, having access to the different databases, having like sufficient internet, as this was a challenge for some countries. And they also should have a strategic organizational linkage, because the policy support organization cannot conduct a research. It's not its responsibility. So they should have a sufficient understanding when to connect with whom and in what pace, because they will need a lot of collaborations on the different aspects and issue they have to address. And they also choose what programs to start with and what service they start with, because there are different approaches to support policymakers, including, for example, which Firas already mentions, policy dialogue, policy brief, running a database. Depending on the available fund, they might not be able to run all of the activities at the same time. So they should select what to start with based on what they think in their context is more valuable and more trusted in their context. Next stage, please. So once that is done, the next will be assessing the performance. And this could be assessing the performance of the entire organization, or assessing the performance for a specific task or a specific activity the organization is doing. And they should also have a larger plan, which still research ongoing on this area, which is assessing the impact actually of these organizations or these activities on the policy choice which will be implemented. And based on this assessment, the organization should consider refining if needed, and they might go back to the stage before. Next stage, please. So the last stage will be the maturation stage. And it is very important to ensure sustainability of the organization work. It's very important to make sure that the organization work and supporting policymakers is part of the system. It's part of the new norm, being systematic and transparent. If they will reach to this organization, then utilizing evidence in crisis time will be much easier, and it will be much like this is the new norm. Next, please. Next and next. So it should be clear, next please, that this process is very iterative. Next. And different organizations might start from different stages depending on what they have already in the ground. If there is sufficient awareness, then they might start immediately with situation evaluation or with the assessments if there is some activities going on. So it is an iterative process. Even after assessment, they might go back to the development stage and make some changes, expand in the audience, change the activities or something like that. Next, please. And as we have mentioned from the beginning, the process of informing the policymaking with evidence is very context specific, and it is usually influenced by different factors at the political system, the health system, and the research system level. And the main factors which has been identified here to influence this process of establishing a PSO is the idea itself, the belief on the importance of evidence-informed policymaking, particularly by top leaders, and the trust between policymakers and researchers. The more they are communicating and working together, more trust will be built and more potential for collaborations will be assessed. And the last one is availability of resources. As I say, financial, human resource, and infrastructures are all very important and should be in place. So this is the framework, and if anybody would like to have more details, it's published in the International Journals of Health Policy and Management. And now we will leave you with Faiza to talk more about the humanitarian the aid system.
Great, thank you, Sultana. I think this is a beautiful way to show you from a system level what it will take to actually support evidence use in humanitarian crises, and specifically in any country that's looking to support the foundation for a PSO. We turn it over now to our third system, especially one that's actually been challenged recently to collaborate very effectively with the three other systems. And here I'm speaking about the International Humanitarian Aid System, and I turn it over to my colleague, Faiza.
Hi, thank you, Firas. It's a pleasure joining you and our panelists for this very interesting and important discourse. And I think Sultana has set me up perfectly with the framework that she just shared. And the example that I'm going to share today actually feeds into a lot of things she mentioned around foundations, building capacity, assessing the performance, and then sort of redefining our goals. So I work with the Canadian Red Cross, which works as a humanitarian organization, aid organization. And our example of building knowledge and evidence capacity to support our health-related programming internationally is one example that I'd be talking about, but also how we pivoted or leveraged that capacity to provide rapid support, evidence-based support to our surge in programming as a result of COVID-19. So if you go to the next slide, please. As I mentioned earlier, I'll be talking about these two things, but I also want to mention that interestingly, there's been a back and forth. So our knowledge capacity or our research capacity that we've been building over the last few years focused on our international programming. And then when COVID happened, we were able to leverage that and work in the domestic field in Canada. But interestingly, we're the knowledge that we produce now with our work in COVID-19, we are using that to again support our international colleagues in the field as well. So there is quite a lot of back and forth in the work that we do. Next slide, please. So this is our wonderful team at the Global Health Unit at the Canadian across. Traditionally, we are a technical advisory group consisting of clinical and public health professionals providing support to international humanitarian programs. Most programs related to maternal neonatal child health, sexual reproductive health services, nutrition, menstrual hygiene management, for example. We also have worked in outbreak and epidemic programs in the past. So more recently, as I mentioned earlier, especially the past couple of years, we've been trying to build research capacity. So not only trying to build a capacity where we provide a more evidence-based knowledge to our programming, but also utilizing the knowledge gained from our programs to generate evidence as well. And that helped us quite a lot as we move towards providing support and building team to provide evidence-based support to COVID-19 programs. Next slide, please. So there are four thematic areas under which our Global Health Unit Research Evidence and Science team, or the GHU REST team, works under. As you can see, epidemic pandemic as an area expanded quite a lot since March of 2020 with COVID operations. And I will talk about it in the next slide. But we had been working in the epidemic and pandemic support area for quite some time. So in the past, we had been working with IFRC on community-based programming, and so there were existing supports in pandemic planning within the movement that we've been working on. But obviously, the scope of work increased quite a lot over the past few months. Other areas that we've been working on in trying to generate more evidence is our programming in various other countries and under various topics such as health in fragile settings, including conflict settings. So we've been working in Afghanistan and Mali. In Afghanistan, for example, looking at the impact of female health workers in providing support. In Mali, how did the community health workers do in providing basic care and additional care such as providing antibiotics and other medicines. So a little bit of different programming and scope in those terms. We've been working in outbreak management in different countries such as Somaliland. So we've been looking at lessons that we learned from deployment of cholera treatment centers in Somaliland, and how we transferred the capacity to local Somali Red Crescent so that future epidemics or outbreaks could be controlled by them as well. So there are different themes that we are working under to provide this knowledge and support, but I'm going to talk a little bit more about epidemic and pandemic related work that we've been doing. So next slide, please. So these are different areas that we've been working on. So again, there are two facets to it. One has been about generating evidence, then also about translating some of the evidence and knowledge. So what we found that as our programming surged over time, we were asked a lot of questions from the field. And as a result of answering, we answered a lot of questions, we created a lot of evidence summaries, tools, but we also started generating some more evidence to our research, and Firas is involved in one of our lessons learning exercise from services that we delivered. But we also built capacity by providing by having students, volunteers, doctoral students, master's students in our team, building that team, surging as quickly as we were for our programs, and that happened because we already had a system set up. I'm going to quickly go over some processes. If you go to the next slide, please. So this is sort of I'm going to give you a flavor of how things work. So our processes are more integrated. We use matrix management. So for example, this is an example of our health and scientific health and security committee that works with our input as a science and research team. What happens is when we have new developments and new requests coming in, we start creating a draft, answering a question based on the latest evidence, which goes through different approval processes, and we work with legal and security team. And that's how it's improved for organizations. So one example for that I can give you is we've developed protocols for returning to work, contact tracing, etc., etc. And we've worked in a manner that we can work with different units within our organization to provide that support. Next slide, please. So this is an example of some of our outputs. We've answered over 300 questions in the last 6-7 months, produced a lot of infographics, which serve as, sort of a knowledge translation, a quick review for our policymakers at the organization who can look at where the pandemic is headed to provide the support. We've created a lot of tools. If you go to the next slide, please. We are also doing what Sultana mentioned in terms of trying to sort of manage the process, identify the problems, and have a feedback cycle where we can assess our work as well, and trying to apply scientific methodology and rigor to the work that we are doing. Through using this knowledge management framework, and we're hoping that that we keep on using the feedback cycle to improve the work that we're doing. Next slide, please. So this is an example of our knowledge management platform. We, as a result of the work that we've created, we've actually created a hub where we have stored all the information, and we're continuously building to improve and present the work that we've done in a user-friendly way. And we take that feedback from our organization to constantly improve and make sure that they get access to information in a way that is more useful to them. Next slide, please. So in the end, we have a few key lessons in terms of evidence support when we surge during humanitarian crisis as an aid organization. The first and the most important thing that we found is that having that knowledge generation and management capacity existing was very useful for us as we pivoted to COVID support. And then building partnerships, so having those academic partnerships and partnerships within organizations where we could talk to people within our organization and leverage their support to provide information and knowledge that is more useful to them. And then surging through having students and volunteers with some systems that we had already established. We used a lot of innovative approaches in terms of developing our tools. The biggest thing in those innovative approaches was not only using the scientific evidence, but also focusing on what our program people were telling us or asking of us. So instead of giving generic answers, we were providing answers that were specific, or tools that were specific, and that those programs could use quickly, so that they would be helpful to their own work. Communication was a key lesson that we learned. So to build trust was especially important with our programs and people in the field, as most of the people who are working in search for COVID-19 and working in humanitarian aid work, they're pressed for time. So so when we are providing support to them in terms of providing quality evidence information, we found that they were more willing to share their experiences and be part of generating that knowledge with us as well. I would really like to thank Canadian Red Cross, my university of Western Ontario, MITEX, and Canadian Institute of Health Research for supporting this program. And thank you very much. I look forward to the question and discussion.
Thank you so much, Faiza. That was incredible. I just want to help tie in a little bit of the points that's going through the presentation so far. We started our presentation today talking to you about overall strategies from different systems. We shifted focus to Fiona, where she shared the need for rapid assessments to help inform programs. And if you noted from Fiona's presentation, sometimes that assessment is not there and you have to build the infrastructure to support it, which led us to Sultana's presentation, which she detailed for us a very thorough framework about how to establish a PSO in a country that is required evidence generation. we finally turned it over to Faiza, who just presented a brilliant sort of talking points around how do you actually, once you have the infrastructure in place to support evidence use, how do you leverage that? How do you build partnerships? How do you utilize innovative approaches to document lessons that you're acquiring during a crisis that requires a rapid evidence synthesis? We finally turn our attention now to our last presentation of the day with, last but not least, Ms. Sean Rudge, who's the head of Evidence for Action Division at the SAS Institute in Australia. Sean, over to you.
Thanks, Faraz. And great to be with everyone, and really interesting to hear all the other panelist discussions so far. So I need to click this, and I think we're underway. So, so thanks. Next slide. So yeah, next slide. So as Faraz said, I'm going to be speaking about key lessons from my experience about supporting the use of evidence to inform decision making, and that of the SAS Institute, which is the organisation that I'm from. Next slide. So just by way of context, the SAS Institute is a not-for-profit organisation based in Sydney, Australia. We were established in 2002, and we were established with the State Ministry of Health with the specific purpose of supporting the use of research in decision-making in government, non-government and health service organisations. And we do continue to receive core funding from the Ministry of Health. So we're independent, we're not part of a university or research group, but we do work through a wide network of researchers, including our 58 member organisations who are universities or research institutes. And where the SAS Institute sits is kind of in that in-between space, and acknowledging that these are not mutually exclusive worlds, but our role is in building connections, building processes, and supporting the use of evidence in decision making. And we do work with a large number of government, non-government and health service organisations to support the use of that work. So over that 18 years that we've been around, we've developed and tested and delivered a range of systems, services and research assets. So things like our, so sorry, I think it's got an automation on there. Can we go back to the previous slide? Systems and research assets like our longitudinal cohort study of ageing, our 45 and up study. So I'm speaking from that experience. Thanks, next slide. So when I was thinking about what the key lessons were to draw out from this, I did call this slide providing tailored syntheses and summaries of evidence as a way of drawing out some of that experience. But I actually think this slide is more about understanding organisational priorities and needs. So early in the life of the SAS Institute, we did work with decision makers to understand what their challenges were around using research. And I know a lot of those things we know well now, but things like the research wasn't around to answer their questions. They didn't have time to wade through the vast amount of research, and in some case, not the skills to be able to do that. So one of the first things we did was develop our evidence rapid review next. And that really was just developed to answer very specific questions that were policy or practice questions and bring together the evidence to address those. So we've done a lot of those. We've done about 330, and we know from other work that we've done that that's used and it's useful. But however, we know also that those evidence checks are only read by a small handful of people, and they're not so useful for other audience. And so more recently, we've developed other formats like our evidence briefs, which are summaries of those evidence checks, and they're written in a plain language style. They're using infographics, which other presenters have referred to as well. So this year with COVID, we've been moved to do something that we've been trying to do for a while, but that's to develop a more rapid review process. So our evidence checks take about 3 months. And as I said, we know that they're used and useful, but 3 months is not so useful when you're trying to make decisions in a crisis situation. And so our snapshots, these more rapid reviews, we are doing in 3 to 5 days, and they've been used to inform a range of decision making during COVID here. And I just wanted to underpin our knowledge brokering. As I said, I think this slide is more about understanding organisational priorities and needs. And our knowledge brokering process is really designed to really fully understand what it is that an organisation needs and make that clear to the reviewers or researchers who are undertaking the work. Next slide, thank you. So those products are useful and used, but they're quite static. So one of the other things that we have been doing more recently in the last few years is this work in dynamic simulation modelling, which draws together not just that sort of more static evidence from literature, but brings together data, expertise, local knowledge to build a model, to create a what-if tool, to test a range of possible solutions before they're implemented. And many of the situations that we're all working in are complex. And again, I think this slide is around working in complexity, because it's the sort of situations that we're often dealing with, including in crisis situations. And the sorts of work that this is being used for are things like suicide prevention, childhood overweight and obesity, and so on. And we're also doing work now around hospital planning for COVID using the modelling. Next slide, thanks. And so just as a sort of like, this is part of the modelling, but just to emphasise the importance of that participatory approach in building it. It's not, I mean, it's important, it's vital for building the model, but it's also really useful for building engagement in all of that process. Next slide, thanks. And really working in partnership is one of the other really key learnings, which I know a number of the other panelists have referred to. And it can look quite different depending on who you're working with and the sorts of organisations you're working with. And I've just used the example of a search study, which is a study with urban Aboriginal children in Australia. And from that partnership, the important things were that the research priorities were set by the Aboriginal communities, and that those communities are partners in that research, which nothing happens without that approval. And there's no publications done, no media or anything without the input of those communities. And I think I may be running out of minutes, but just to say for that work, one of the important things identified was ear health issues. So the earlier research was around understanding what that was, what the challenges were, what the issues were, and a further partnership then enabled the delivery of services to support that, so for treatment and therapy, as well as establishing longer term relationships. Next slide, thanks. So just to finish, I think that there are lots of different ways of supporting evidence, and one of the key things is that might change over time depending on organisational capacities and needs. We work with complex problems, and our systems about how we do that work of supporting evidence will evolve and will reflect that complexity. And I think perhaps just to finish, I would just say that working in partnership really underpins a lot of all of what I'm talking about. So the work around building trust, being respectful, responsive and flexible is really a vital part of all of that work. Next slide, thank you. And just to acknowledge a number of my colleagues at the SAS Institute, and I'll say thanks very much, and back to Faraz.
Thanks, Sean. That was incredible. I think what you did for us is that you illustrated to us some of the soft skills or essential human skills that are important in building a collaborative relationship in order to deploy evidence when needed. So I want to thank everybody, my panelists who presented really great insights in their own sectors, in their own fields, in their own contexts from across the world. And now I want to turn to some very important questions that were generated during our session. I'll start my question to Fiona from one of our audience members. Fiona, what they would like to know is that, can you please be more specific on how UNFPA gathered the data with all the COVID constraints to avoid direct contact? And were there any steps that your team took to protect the health workers delivering the services and the people gathering the data? Over to you, Fiona.
Thank you, Firaz, and thank you to the attendees who are asking the questions. Regarding the steps taken in terms of protection whilst doing the research and how the research was carried out. Well, the research was the assessment was done in partnership with the Ministry of Health. The Ministry of Health staff in our districts, we did the assessment in 6 districts, where we worked with the district health officers and the community health volunteers who are working in those districts. And with them, of course, as per the guidelines and per the processes, each individual was provided with the necessary equipment and protective equipment that was necessary to support in the process. So all steps, all actions were taken to prevent any infection. But the good thing is, at that time, the infection rate within the country was very, 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 very low. And it was mostly coming in from the airports rather than within the communities. But the action taken at the time by the government was to close all facilities, all access to all. So it was a complete lockdown at the time. So fortunately, in those districts, there wasn't any identified case or any suspected case at that time. On the second question, sorry, what was the second question?
Sure. The second question was, were there any steps that your team took to protect the health workers delivering the services and the people gathering the data?
Okay. So in terms of providing, in terms of the provision of services which came during the response now, each of the health workers were provided with the necessary PPE equipment, particularly for the pregnant women response. The midwives were provided with the necessary RH kits that were necessary to provide the services that they needed. So the aprons, the gloves, all the equipment that they needed to have in terms of provision of services. Thank you.
Great. Thanks, Fiona. I turn it over to Sultana. Sultana, one of the questions we have for you is that, do you think that the elements you outlined in the framework that are necessary to provide the foundation for a PSO play out the same in crisis zones and fragile contexts as high-income countries? How do you, the follow-up to that question is, how do you convince policymakers in low-income settings towards the need for PSO when there are limited funds available and competing priorities?
So I think this question has 2 parts. If I'll start by responding to the first part, which is the elements of the framework, actually we draw those elements from countries, from low, high and middle income countries, and from different settings, including countries in a conflict zone. So yes, I do think that these elements are applicable to the different settings. For example, awareness is important. If there isn't enough awareness, then you cannot move forward. You cannot ensure the buy-in from the policymakers about the importance of having these organizations. So which one or which elements will be more important? It depends on understanding the actual context where you want to establish the organizations. And the second part is setting toward the needs for. Yes, so if there is a limited fund, that's what I say, like evaluating the situation, highlight how having these organizations might help. what kind of support these organizations can offer. For example, you can show them by taking the proof of concept approach that we can help you, or this organization can help with the available resources. You always should try capitalizing on the available resources. Even if it is one individual, that individual can pick on one topic, prove the importance and the role of this organization can do by doing a policy brief, and move from there. Once you will start to get their attention and convince them, this organization actually here to support. Actually, they are here probably to help in reallocating some of the budget component and assisting some of the programs. So if you will show the way you can help, depending on the issues your country is having, I think that should be a very way to start advocating for this organization.
That's great. Thank you, Sultana. That's really helpful. Sean, I want to turn it to you. And there was a question from the audience. I mean, we thought that the idea of the checks, briefs, and snapshots that your organization is producing is quite brilliant. And one of the audience members just wanted to understand what the nuances or the differences between each one of those.
Thanks, Faraz, and thanks for the question. And it is a really good question because sometimes it's a little bit hard to sort of easily explain what the difference is for something that might take you 3 months as opposed to something that you can do in sort of under a week. So look, I think the main difference is that the level of comprehensiveness that goes into an evidence check. And generally there are more questions that are being answered. So we'll often ask, there'll often be 3 or 4 questions. And we do, just because they're still rapid reviews, there are still parameters around that. So we would still limit the search, limit the databases. The other main difference is the level of analysis that would go into an evidence check. So it's not just sort of finding the papers. There's a great deal of synthesis that goes on with that. With the snapshots, we are limiting that generally just to one key question. So, you know, what's the evidence on the effectiveness of masks to prevent the transmission of COVID, for example? And we tend to limit the number of papers included in that so that we can do that in a timely frame. I guess one of the things about the literature around COVID is that it's quite time limited. So we're not having to go back 5 or 10 or 20 years. So it really is all coming out of this year. But it really is that we are limiting the questions, the scope, and there's not the same level of analysis that goes into those briefer snapshots. Key to all of those is really being clear at the outset exactly what the question is and what the scope. And I know that's kind of fairly obvious, but it is one of the things that can go wrong when you're doing those reviews, is that you haven't got it well scoped. So that's why we spend time at the start making sure that it's well scoped so that everybody's clear. So the agents, we've really captured what the agency wants, and you know, we're clear about what we can deliver as well. So I think that's the main thing. I think with the evidence checks, we have had opportunity to sort of more formally evaluate those, and we do know that those are useful and used. So on average, evidence checks are used for about 3 different purposes by the agencies that commission them. We haven't yet had chance to do that same level of evaluation with the snapshots. I guess the other thing I would say just about the evidence briefs is that while they're a summary of evidence checks, they're not just a summary. There's generally another bit of work that goes on because they're for specific audiences. So they're not, so we've got evidence checks which are already there and useful. So you might be wanting an evidence brief that's perhaps for your clinical audiences or for your service delivery, which might be written in a different style. So there's work around extracting the key messages in consultation with both the researchers who've done the work and with the organisation, so that those key messages are clear and are worked up further than perhaps what's in that sort of bigger evidence check review.
That's great. Thanks, Sean. I guess I have a follow-up question. That do you conduct any assessment of or the quality of the evidence, especially when it came to evidence checks? One thing we've noticed at Evidence Aid, where I used to work, is that we had a big issue of assessing the quality. There was an infodemic. The generation of evidence towards to address the COVID-19 pandemic was insane. I mean, it was skyrocketed, went up about how much evidence was generated. And the big question became is that when you're creating those checks, are you actually looking at the quality of that evidence? And if so, how are you assessing that?
Yeah, another really good question. And it is one of the challenges when you're doing something quite quickly, that there's a risk that, you know, the quality might not be up to scratch. So with those snapshots, we've been doing them in-house. So we have been calling on, it's kind of an all hands on deck process for those things that you're trying to do quite quickly. So there's not, we do work with an external content expert for those. So it's not a separate peer review process as such, but we do have somebody who is a recognised content expert who provides input into the search strategy and also reviews the draft and provides input into that. So we feel like within a time frame of, you know, less than a week, that's you know, that's a reasonable process. With the rapid reviews, the evidence checks, which are that sort of longer process, they don't go through a formal peer review process like you know, a peer review publication, but again, that we have sort of checks and balances to within, because generally we work with content experts to undertake those reviews, and there's generally a senior person as part of that team, and we also review those when they come as part of that process. So yes, and I guess one of the things that people have always been a little bit concerned about is you know, there's sort of different, you know, are these still as good as other types of reviews? And I think by and large, our experience is yes, they are, and that they're, you know, this is what the organisations are looking for to support their decision-making processes.
Great. Thanks, Sean. Faiza, over to you. There's a question about, you spoke about the need to generate evidence to address some knowledge gaps you are facing in program delivery during COVID-19. Can you share with us some thoughts you have on whether evidence synthesis initiatives should be delegated to academic institutions or specialized policy centers like Sean's? Or do you think that a new framework is needed to establish a collaborative structure between academia and the international humanitarian aid sector?
So thank you. This is a very interesting question, and this is the last point that I wanted to make in the presentation. Academia and specialized policy centers such as Evidence Aid do play a very important, vital role in providing that evidence, for sure. There's no doubt about it. At the same time, in my experience and in our experience at the Canadian Red Cross, what we found was that a lot of times the information that we have institutionally or on the programs that we work on is sort of lost until and unless someone within the organization takes the initiative to partner with the academic organizations or specialized policy centers. So it's I would agree with the point that it's very it would be important, necessary, especially for humanitarian organizations, to have that collaborative model where we have capacity within the organization built in to work with academic organizations and policy centers, because by nature, aid organizations are working in crisis, they're working on programs. It's very hard for program managers and those who are working in the field to balance the academic collaboration with policy centers. Our example is where we had started building capacity before COVID hit. And what COVID did was actually surged our capacity and the ways we produce knowledge. So it wasn't always a traditional method of generating evidence, although we're working on that, but also trying to make sure that that the knowledge we generate is specific for the organizational needs, be it at policy level, management level, be it at field level, be it to build capacity of our own team within the unit. For example, we've incorporated doing technical presentations each week where we share each other, learn from each other, and invite other organizations and people to tell us or update us with what's going on. And Evidence Aid is one example, and other research institutions that we rely on. So definitely, I think a collaborative framework would be really important, with the view that humanitarian aid organizations, their mandate is to work in crisis, and they're not mandated to generate that kind of evidence. At the same time, if we have built-in capacities, so for example, I'll give you example of our team. We had been working before this COVID crisis um, you know surged in Canada, for example, and our team knew the field, people in the field. Our team was known by the people who are working on the program, so there was an element of trust already. So so that we can serve as a bridge, so that we provide that quality evidence. They can trust us to bring those questions to us, and we work with the policy organizations and academia to provide those answers, and then build new research and new evidence to support this kind of work.
That's great. Thank you. Fiona, I want to ask you a follow-up question in your earlier presentation. You're focused on real-time research evidence with the rapid assessment of needs to convince policymakers to create appropriate services and interventions. You raised you highlighted that need for rapid assessment. My question to you is, what do you believe are important factors to consider when trying to provide real-time research evidence to inform decision-making? What would you say is the important thing you've learned from that experience with rapid assessment of evidence?
Thanks, Firas. I think, when you're trying to provide the right data and the right information to guide programming, you need to have the right information. Basically, I believe, the real-time data makes it justifiable. It makes it guided. It makes it necessary, and makes the intervention that you will generate and that you will do responsive to the needs of the people. So it's very important that you always determine the program that you're going to do to respond to the needs of the population based on what are the current needs of the people. So it's very important, one, to have both the ownership, also the engagement, but also the response to the needs, the immediate needs of the people, especially in a time of crisis and in a time of humanitarian need. Thank you.
That's great. It's funny because it's not funny, but there's a common denominator between all our answers, which is that, Sean brought it up brilliantly about talking about clarifying the scope. And one of the difficulties in working in deploying evidence is working with stakeholders in trying to make sure that research question or that pressing question they're trying to answer or that program they're trying to help, it is so clear what they're looking for. Because in my experience, what I found is that stakeholders use evidence very according to what they believe it is. So we confuse what data is to what research evidence is, to a tacit knowledge and gray literature. And this is why at the beginning of this presentation today in our session, I made a very clear point to say that all those types of information are equally important and essential in informing decision-making. But what really comes down to is, what is the question needed? I want to wrap our sessions. We only have 3 minutes left, and this was incredibly insightful, by asking all of you, if this was Aladdin and I was a genie, and you get one wish on how you want evidence to support decision-making, you can ask for anything you want. What will it be? I'm going to start with Sultana and then go down the line. Sultana, what would be your wish for what you would hope would happen in better support of evidence-informed decision-making, not just in crises, but overall?
I would really wish that the policymakers will be heavily involved from the beginning in all stage, and the evidence-informed policymaking approach will be institutionalized as the new norm in all policies.
That's great. Thank you. Sean, I'll turn it over to you.
It's a kind of a tricky question, but it should be a really easy question. So, what would be the one thing that I could wish? Look, I don't know that I've got a simple answer to that. But look, I think a lot of what we're all aiming to do is to make the process a whole lot simpler. So that might not be a really great wish for the genie, but just something that would really kind of mesh those systems that would enable that, across all of those different systems that would like really provide that structural support to enable the best use of research in decision-making in crisis and in non-crisis times.
That's great. Thanks. Faiza, over to you.
It is a tricky question. I agree with Sean, because there could be a long list of things. I think from where I sit, I think the topmost thing or the biggest thing would be an investment in the resources to provide or generate these evidence, because again, in humanitarian aid sector, this not being a huge priority, a lot of time this work is done on ad hoc basis and from the side of our desks, but we are recognizing more and more that this is essential, vital work that informs not only just policy, but the way we do programming and the way we move forward. So it's essential that there is more investment in this work in all sectors, but especially in the humanitarian aid delivery sector.
And Fiona, your last wish.
I would say it's that we can continue to use evidence to convince our leaders and our politicians and our programmers to invest and to respond to the needs of the people and to take action, so that when we do generate this evidence, action is taken and their needs are met.
That's great. Well, thank you for entertaining my tricky question, but it was a way to end in a times of crises, and COVID-19 pandemic has put a strain on all of us in the work that we do and everybody involved. I think it's time for some hopeful for a brighter world out there. So those wishes, if anybody's listening out there, we would like them to happen. I want to thank my incredible panelists today for your engaging and informative insights. And I want to ask all our audience members to please feel free to reach out to any of us if you have any further questions or queries or would like more information. On behalf of the incredible women I'm joined with today, I thank you all for coming and joining us. And I hope to see you real time, face to face in the near future. Thanks, everybody.
Thanks, everybody.
Thank you.
Thank you, everyone.